many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common getting. In common BISSC, the dead, as in Takrenu assume the dead, the real in common getting. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and our Taibo channel. Kaise, so we see the real in common getting ya. What brabon tete, we nyan konkonsa, we the real in common getting.
Good evening, ladies and gentlemen, Era One Radio listeners and viewers all over the world. I want to welcome you to our studios this evening. Tonight we are broadcasting live from Facebook and YouTube, and the show tonight is Health is Worth Protected. In case you haven't heard me say this several times, health is worth is gleaned from the fact that if you have good health, then you are a wealthy man. You don't spend too much money on medication. So all the money that you get goes into your account somewhere. So take good care of your health and the wealth will follow. Tonight, we are looking at this very sensitive topic. Of course, you know, February amongst many health alertness, one of them is the National Children's Dental Health, in addition to heart health and, you know, a few others. So tonight, we are taking a very closer look at dental health. Maybe you might say, oh, I don't have children, so it doesn't bother me, or all my kids are grown. Well, that's not the case. You might be listening for a brother, a sister, a niece, or somebody that could benefit from this. So tonight, we wanted to join our broadcast, and the number to join in is 240-280-2633. And if you want a text, it's 5109310946. And as I said, we are broadcasting live from our Facebook and YouTube channel. All right, tonight I have the singular privilege on behalf of our health team, the CEO, Dr. Tutu, and everyone in Era One. We are privileged to have once again our one and only, you know, beautiful, smart, whatever, all the adjectives that you can use. Mrs. Emma Jeffrey, of course, is a dentist doctor, so that title also comes to her name. And she was in our studio, I think last year, July, if I'm right. She's back today to help us tackle this very topic. And in case you don't know who she is, I don't want you to be, you know, guessing who she is. Just let me give you a little bit of bio about her before we continue. Because if you meet somebody on the street and you don't know the person's name, all you say is, hey, excuse me, whatever. But I want you to be able to address Dr. Emma Jeffrey in the studio. If you have any question, as I said, call in and let's partake of this discussion. I'm just going to be the moderator. She is going to be in the hot seat to answer all the questions. And you, my listeners, bring in your questions and she will be able to tackle every one of them. All right, so Dr. Jeffrey was
announced to our people gather that we are finally open. And
she married, of course, I said that. Does she have children? Yes, she has 2 kids, so she knows how to treat dental problems. All right, so what are her interests? Her interests are dentistry, of course. She just likes playing with the teeth. I mean, when I saw her, the first thing she look at my mouth, because all she wants to see is teeth. She's crazy. You meet her, the first thing she wants to see is teeth. So she's somebody who's crazy about teeth. She plays keyboard. I don't know whether I should have asked her to come and play one of her. She plays beautifully on the keyboard. Of course, she's a church person. She likes sewing. She likes doing crafts and lately gardening and decorating. And then her source of inspiration is her faith in God. And speaking about faith in God, I'm going to give you a quotation before we start or continue. The Bible talks about grinders in Ecclesiastes chapter 12, verse 3. It says, in the day when the keepers of the house shall tremble, and the strong men shall bow themselves, and the grinders is because they are few, and those that look out of the window be darkened. So dental issues are even in the Bible. All right, I've been talking too much. Doc, you are welcome. Any opening remarks?
Thank you very much. It's an honor to be here again, and I thank you and Dr. Ostis and your listeners for welcoming me back to the Era One Radio studio tonight. And I look forward to the questions you have for me.
Thank you. After today, I'm going to bombard you, so get ready. Get ready, pa. All right, before we continue, let me remind you where you are. You are on Era 1 Radio.
Kosuanati Era 1 Radio. Empenyini say, Yensuma na motenten, yesuma benyasafo, Era 1 Radio. Yedin sem anumwaye ebrem.
Therefore, Embre, Yebeka, Esenwasem, Esin, a fine collar who sing, Bekna Casso, Bubecaso, to see a member. Me many name coffee in Colas near the day, a here pa, because Ansana, see a bibiso and Yankupon mouth, first chance, second chance, or mouth, third chance, into lose a permanent one now. You are going, you don't get it, and tell you be one some year back until war in Cola and Pacho, Tipa, the baby boy, bro, because we share Dr. Jeffrey baby. All right, Doc. I know, as I said earlier on, February is one of the months that we celebrate National Heart Month, and Children's Dental Health is one of them. All right, so apart from the teeth helping us to smile and, of course, to chew and to eat, why is dental health so important?
Well, dental health, again, we would default to what we like to say these days, oral health. The mouth is not separate from the rest of the body. And, you know, whatever happens to your mouth tends to, you know, affect the rest of your body. And that's why it's important. And when it comes to children, they are developing, and we want them to eat properly. The nutrition is, you know, connected to it, and it's not even just children. Geriatric populations, older people, even, you know, regular adults. Everyone's health is connected to, you know, how well you eat, and if you don't have good teeth, you can't eat properly. Also, you know, dental infections can occur, where people can end up in the hospital. It can become, you know, fatal if things are not handled properly. It's very important. You know, it affects speech development in children, etc. So dental health evidently or oral health is tied to the overall well-being of the individual. And see, that's why.
All right, thank you very much. Yeah, I know, as you said, it's even connected to heart disease and all this research have been going on, so interrelated. All right, so we're looking at dental health in children. Of course, we learned this axiom that he who is down fears no fall. All right, so if a child has primary teeth of, let's say, 20, if I'm right, primary, you know, baby teeth about 20, and they eventually going to fall or be shed for the permanent teeth to come, why do we have to worry about something that is eventually going to fall? What I'm saying, for those of us, she say a baby teeth, no quality teeth, no no, and Yankupon say we so up to some age, you know, over 20, and then you know, fall in your bit to 2, not permanent one another. And to say, so when temporary one a bit to 2, why I didn't say worry about, and I didn't injure the beer, no more brand, I permanent ones number.
Yes. Definitely primary because of primary teeth, but baby teeth, you know, they don't just fall out after 2 years or not 3 years. Some of them are there until the age of 12 or 13.
Okay.
And you can say they don't fall out until the age of 6. By that time, that's how they're going to be speaking to their peers, building their self-esteem, etc. As their children, nourishment, and as I touched on briefly earlier. And, you know, it's important to, I would say, so that akolano etimi didi obinya confidence akasa, it affects speech development. Say akola inum enshiranye health, you know, intimi enkasa intimi didi. Again, it affects the health as well, other health factors, and, you know, because of bad teeth. Also, the primary teeth and baby teeth, there's also a holding space for permanent teeth. And teeth. So if you are in painful or the permanent teeth and the space in your home, it's me feet baby basa which and also to meet the other problems about. That's why it's necessary to take care of them, so, you know, they don't cause infections and all of that in the child.
Oh, okay. That's a very good point that you brought across. We'll go back to that question again later on in the broadcast. But let me go back to, you mentioned how long sometimes the teeth last in the baby's mouth or children before the permanent one take over. A mother might be wondering, let's say a mother has a baby, could be her first child. So, normally with first children, everything is anxiety, everything is excitement. They want to see everything parting, going the way it should be. So if there's any little deviation somewhere, they tend to be, hypertensive and all that. All right. So when should the mother or father expect their baby to have the first eruption of their teeth? At what time frame or range do children begin to experience their first teeth?
So normally we would expect the teeth to come in around 5-6 months. Then you begin to see the lower primary teeth or baby teeth coming in. But at the same time, this might come as a surprise. There might be a few extra lucky parents who might welcome a brand new newborn with teeth already. When people see that, they should not panic or anything. And when say be a problem, then they can seek help from a dental professional. But yes, for the most part, the primary teeth or baby teeth don't start coming in until 5.5 to 6 months thereabout. Ebeba all the way till they are about 2 and 2.5 and all the baby teeth will be in.
Oh, okay. So the mothers on the show, those of you who just had babies and your babies are just 1 month, 2 months, and you are praying for them to have their teeth so soon, just chill and relax. They will come. Don't be too aggressive. They will definitely come. All right. In case you just joined us, you are listening to Era One Radio. We are live on Facebook, YouTube, and Modern Ghana Radio. If you want to join the conversation, the number is 2402-802-633. And if you want to text us, it's 510-931-0946. And tonight, I have Dr. Emma Jeffrey in the studio, discussing dental health in children. All right, so Doc, we are going forward. It's now 6:20, and I think we are making time, although technical glitches made us start a little late, but that is fine. All right, so this question kind of bothers me. Most children have pretty beautiful, pretty baby teeth. And then when those are shedding and the permanent ones are coming, either the primary ones don't leave early, or the permanent one don't take their time, or for the primary to leave before they come. So they are pushing and they are fighting. And so the permanent ones that eventually come up, I'll call them jacked up. They are kind of, all over the place, and they go through orthodontics and what causes that?
So everyone has their own genetic, composition, if you will. Okay. So genetics plays a huge role in that. And also there's evidence that there are also environmental factors. Nutrition is also a potential factor. But for the most part, it's just how things are in the genes that will, dictate how soon teeth are, or how, the baby teeth and the permanent teeth as well in the bone that will be coming up, arranged. And see, for some people, they are fortunate, teeth come in at the right time, in the right positions. For others, they come in, crooked, as you have, indicated. Yes. So we are all different in that sense. And see, when it's time to intervene, just knowing the right time to see, well, of course, hopefully you're seeing your dental professional already, so they will know when it's time to refer you to an orthodontist. That would be your braces doctor for braces, and for them to help correct any abnormal positioning of the teeth. And it's also important to remember that, when we look at teeth and we say, oh, they're positioned properly, sometimes we tend to focus just on the teeth, but then yet sometimes it's also the jaw development of the child. They might need other surgery in addition to the braces work. Just arranging the teeth might not be enough, and so there's a lot that goes into that. So they will do an assessment of how the craniofacial bones are all developing. And I say facial bones, the jaws, top and bottom developing, and then they'll make a proper assessment as to what else is needed in addition to braces, if anything else is needed.
All right. Thank you very much, Dr. Jeffrey. Well, listeners, you are still on Era One Radio. We are live on Facebook and YouTube. Please direct your questions here, join the conversation, and let's learn as much as we can. All right. So some part of, I would say, underdeveloped countries or developing countries don't have much access to dental treatment, therapy, health, and all that stuff. So for some of us, when we're growing back in the days, we don't even remember going to see a dentist when we were children. It's only later in the years that you realize that, oh, no, you need this. So fast forwarding, how often should children be made to see their dentist? What is the regularity? I mean, how often should they do it? Or they don't have to do it until they are old?
So it's recommended by, since we are talking about children, the American Academy of Pediatric Dentistry, they recommend that as soon as the child gets their first teeth. Okay. So you're thinking 6 months, right? So for some people, for a lot of people, that's not practical. They are saying that, and the reason is that it allows you to establish a dental home. And so as the child grows up, they're not going to be too worried about, going to the dentist, etc. If that's not practical for you, as soon as the child can cooperate, it's also a good time to go. But then as far as the frequency goes, going to your question, the specific question you asked, it differs from person to person. Although many people think it's 6 months, a year for everyone. There's an assessment. There are various ways we assess a patient, and not everybody has to see a dentist every 6 months. It is based on your risk of, getting cavities, what has happened in the past. And that's based on looking at the x-rays over the past, so many years of seeing one professional. They will be able to judge, is this person brushing their teeth properly? Are they likely to get disease going forward, looking at their history, etc. So some patients will need to go in more frequently. There are some children who don't brush their teeth well. We see their gums are always inflamed. They will be put on a 3-month recall or a 4-month recall, as opposed to a 6-month. And then a 12-month for those who are, really doing well, etc. So it all varies. But I think the standard usually that people hear about is every 6 months. So.
Oh, okay, every 6 months. I did. That is good. I mean, that will at least help the parents to detect anything that needs to be known before any complications coming. All right, we are listening to Era One Radio, and Dr. Jeffrey is on the other side of the line. Thank you, Doc, for graciously honoring our invitation. And let me just give a shout out to my own boy, Dominic, who celebrated his birthday on the 13th. Dominic and my daughter, they are 2 days apart. Dominic came before Valentine's Day, and Joel came after Valentine's Day. I think we all kind of planned it because we didn't want to mess up our Valentine's Day. So, one came before and one came after. So, Joel and Dominic, enjoy your birthdays in February. All right, Doc, we are going on. You mentioned braces. In this country, I mean, back in Ghana, I don't think I even growing up saw anybody in braces. I don't remember. It's been years, but now I think things have changed dramatically. So it's a different story. But here, it looks as if the kids love braces. I mean, these elementary school, middle schoolers, high schoolers, looks as if they fancy wearing braces. It makes them feel cool that, I got braces. And they go to their orthodontist every maybe month or week to change their colors. I know my daughter will go and last week it was blue. The following time she goes, they change to pink. And it's so cool to them. What is the principle behind braces, and how does it actually work to straighten teeth?
So braces, first of all, when the orthodontist or your general dentist notices that there are, there is some malpositioning in the teeth, and they will recommend, or sometimes the parents themselves may, bring a situation up. And once you're referred to the orthodontist, they will also do an assessment, and if you need braces, braces, basically, they do what we know braces to do. They will move the teeth slowly. So applying the right forces in the right places will move the teeth a certain way, by so much. And every time you go, it's just by applying incremental forces at specific places to, get you to the desired effect. So I'm not sure if is that a good enough explanation of.
Yeah, I think it is. I think it is good. Yeah, it's great. It's great. Thank you very much. I know our listeners are listening, and please, if you have any questions, like I said, call into 240-280-2633, or you can text to the studio 510-931-0946. This time, I'm going to take a quick commercial break, and listeners, we are here to support whatever you are doing. If you have any business that you want us to advertise from on such a medium, when Dr. Jeffrey is on the other side of the studio, giving us all this apoconcro and dental health, you want to broadcast or advertise your program. I mean, we are live on Facebook and YouTube, and also generate you some, revenue or get you somewhere. So if you have any commercial you want us to, we used to call in those days, bash for you, play for you, we would do so. We have a hospital in Ghana, Dr. Eben, doing great. I don't know whether he has a dentistry over there, but I think with such a prolific thing that he's doing, I think he should have one. So I want to play his clip for you. Those of you who are in Ghana, if you have any medical needs, don't hesitate. I know sometimes Kolebo might be choked and you want to drive somewhere and get a quick medical treatment. So let me recommend this to you. And when you are there, visit them and enjoy their facility.
Hello, beautiful people of Ghana. This is Banahine Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Banahine Specialist Hospital, our extraordinary physicians and nurses are here to provide a high quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us for all your healthcare needs and you will be happy you did because we believe the health is wealth. Thank you and stay blessed.
All right, that is Banahine Hospital on Spintex Road in Ghana, near Tema. All right, before the break, we were talking about the principle behind braces and how they work. All right, I said earlier on that if you know something is going to fall, do you still worry about keeping it straight or clean, or you just leave lackadaisically anyhow and let it fall and think that your permanent one is going to come in? Well, if you take care of the primary ones well, I think it will help to have your permanent one also restricting. On that note, I'm going to ask Dot, how many times should children brush or be made to brush their teeth? Because sometimes when they are going to sleep, going to bed, you have to remind them, or they feel like, oh man, I don't want to do it. But I think it's very important because after eating all that food and all the mold and stuff, they get stuck in your. So it's a good idea. How many times has it been recommended for children to brush their teeth on a daily basis?
So yes, the magic number is 2, as we all know. Yes, so twice a day. But if you notice, you have a child, and they shouldn't be snacking too much anyway. But if you have a child on a special day where they are snacking on sugary things and all of that, and you feel like adding an extra one in the middle of the day, feel free to do so. But definitely last thing before they go to bed at night, because when the mouth is closed, the bacteria get to work and they do a lot of damage. So nighttime brushing is crucial.
Oh, okay. So whilst you are sleeping, enjoying your sleep, snoring, the bacteria also on their night shift working in your mouth. So it's very imperative that you brush before you go to sleep. All right, let me ask this. Oh, sorry. Did you want to add anything?
Oh, I said absolutely.
Oh, okay. Yes, all right, thank you. Let me ask this funny question. Back in the days when we ate, you lick your hands and everything, the food is so good, you still want to have the sweetness or the taste of your food in your mouth. But then we, after years, we are told to rinse our mouth after eating or something. To me, or in those days, we felt like when you rinse your mouth, the sweetness of the food all washes away. So what you ate, you lose the taste. Is it recommended to rinse your mouth after every meal?
It's no, not definitely. It's not practical to do that on you might be outside. You're not always at liberty to do that.
Okay.
But I think it's a personal choice. More so, if you don't feel comfortable with having some people due to their specific dental if their positioning of the teeth may have teeth stuck food stuck in the middle of their teeth. Absolutely, you want to wash it especially if you're going to be without your mask then and all of that. But if it's a good habit, it doesn't hurt, but it's not there's no set of rules or rigid rules that says that you absolutely must wash your mouth every time you eat something, but it will help. Mouth rinses have some fluoride in it and all of that. So if you're eating a high sugar, high carbohydrates, rather, when we say high sugar, everybody thinks it's always the sugars, but it's not just the sugars, the high carbohydrate diet, then it always offers a substrate for bacteria to work on. So yes, you want to decrease the risk of getting all kinds of diseases in your mouth. So
okay, thank you. Well, this is a joke I'm going to slide in, but the COVID, as bad as it is, and the mask that it brought, in a way also helps some people, because I mean, you put on a mask and nobody knows what is in your face from your nose down to your chin. So whether you are chewing or whatever you are doing, nobody sees what is going there. But then when you take off the mask, people know, oh, sir, I did with the So the mask was kind of, it came to disguise a lot of things. Anyway, that was just by the way. Now let's go. Yes, let's go on to cavities, Doc. Cavities, how do they come about, and how can we prevent them from children?
Yes. So dental cavities, for a long time, we used to think it was, just one track of bacteria in the mouth just doing their own thing. And then, boom, something happens. But we have come to realize that this is it's a process. And it's a matter of having all the factors that are involved present. So we need to have the carbohydrates, as we have mentioned already, on the teeth, staying long enough. So you're not, for someone who's not brushing frequently, all those carbohydrates, the plaque will form with the bacteria being present, the right levels of bacteria. And also, they need time to work on it. So again, it goes to the brushing. If the plaque stays on the teeth for a long time, it gives the bacteria the chance to work on the carbohydrates and break them down to the acids, which eventually dissolve the tooth structure. But at the same time, other factors will be trying to reverse that process. And this is where the fluoride comes in. If you're using a fluoride-containing toothpaste, or if your diet is rich in arginine, which is a more, it's not that recent, but then it's now gaining more steam as we go on. That arginine is one of the amino acids that can actually counteract the caries part that we have talked about. And see, all of these factors some factors will oppose what the bacteria are doing. But if the wrong factors outweigh the right factors, that's how we end up getting cavities. So.
All right. So they are still preventable. Thank you very much. Thank you very much. Well, One Radio listeners, we are still live in the studio, and Dr. Jeffrey graciously came back to give us all this support and information. One Radio is a 24/7 program. Either we are playing music, studio manager, CEO, Dr. Austin is always giving us good music, or we are having programs to educate you. Of course, our mission is to educate, to inform, and to entertain. We don't do any non-far news on the station. We are poised to educating and giving you the best. Tomorrow is Sunday, and Sunday we have a very interesting program in the evening by the ladies. I call them the quartet, but now they are now quintet. They are 5, and they discuss this very, very nice program we call The Real in Common Kitty. And so I want to advertise their clip. I wanted to show up tomorrow evening from 7 to 8 and listen to the profound, wise advice that these ladies give concerning marriage. They take all kinds of topics and they make it very lively. So let me play you the clip.
They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many. The funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real in common getting. In common BISS chain, the dead, as in Takrenu assume the dead, the real in common getting. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and our Taibo channel. Kai said, so we see the real in common getting ya. What brabon tete? We nyan konkonsa. We the real in common getting.
Beautiful, awesome clip and program. Make a date with these ladies tomorrow evening, 7 p.m. and you will call me and thank me. All right, Dr. Jeff, we are still on. And let me take our minds back to the braces. Normally, it's kind of recommended for children in this country or maybe other parts of the world. But if somebody is 30, 40 years old, can the braces still help them or it's limited to age?
Oh, not at all. So braces or, repositioning of the teeth can happen at virtually any age, provided the patient does not have some, serious gum disease or periodontal disease going on. So yes, almost anyone can be, any age is appropriate as long as there are no underlying disease processes going on. So, yes.
Oh, okay. So there's no limitation to age and when you can. If you are 50 and you feel your teeth is crooked and you want to let them to, straighten them, they can still do it. All right. Let me go on to this question. I don't see it too often in this country, but of course, back in Ghana, I would say, I wouldn't even use the word majority, but most people have upper teeth that has this gap. That's Ghana. They call it a jere. And amazingly, if you're a lady and you have a jere, the men are dying over you. I don't know why, but it looks as if it's so attractive to them. Is there a physiology behind it? Or, here in this particular country, US, it looks as if the dentists don't like it. So they will do everything they can to seal it. But in Ghana, it is what is giving women the price to have, the men they want, because some men are just crazily head over heels when they see a woman with a jump and they are so crazy about that. What is the philosophy behind that?
And it's part of some people's genetics. For some people, it can result from there's an attachment between the lip and the bone called a frenum. It can be on the top, it can be on the bottom, and that for children especially, when you see that space in there, it's usually because that tissue, is in the way in between the teeth, and it does that. Like you said, there are cultural, aspects to how it's perceived. And here, in the Western world or with certain races, it's not that common. It's not really perceived as being beautiful. But when it comes to our culture, we probably might have different opinions about it. And it becomes a personal issue as to whether you want to keep it or you want your gap closed.
Oh, okay, that's cool. So those of you in Ghana who are using the jire to, intimidate us and think you're on top of the world, Dr. Jeffrey said it's not any, serious thing that you can brag about. If you have it, that's good, Don't make those who don't have it feel like, you people don't matter. Anyway, well, my niece joined us from UK. Comfort, you are welcome as usual. She joins us on Era One to help with our discussion. All right, Doc. Again, let me take us to our childhood days. When we were younger, I know you were born in a later generation, so still like you are a baby. But those of us who were born a little earlier, when your mom brings you food and the food is so hot, meanwhile you're also hungry, you want to eat voraciously, but it's kind of hot. And your mom would grab the food and blow over it, blow. Oh, is it a good practice? Because now when I look back, it looks as if they gave us too much bacteria while we were blowing into our food. Is it a good practice?
That is absolutely so you've answered the question already. So when we blow on food for children, we transfer bacteria to the food, and the bacteria that we transfer, if it includes the type of bacteria which we call the strep mutans, which converts the carbohydrates to the acids that will cause cavities, then yes. So we dental professionals tend to discourage that we shouldn't blow on food for children. So caregivers, mothers, fathers, etc. And now we know that with COVID and everything, that's also probably not a good idea. So in addition to just cavities and all of that.
All right. So Comfort is saying good education. You are doing a good job with this discussion. So I think at this time you need to take some tinkle of water. I don't want your mouth to dry. So let me just take a quick music and allow you to take some water, and then we'll come back.
Aden urefiana say to me man any about Aden man is you for day Aden me ba Aden kra you send it as was any that's so kra any that's yo any that's so I am to be a any that's oh I do any that's Ana muni padia onse Eden krona mu befra Onyenwe mo kra onse Eden na bedi ana yebanom Ana muni padia onse Eden krona mu befra Okransi na diane Neli padia nsintumana Aden mi ba Aden kra Ya usani da suasa Okransi na diane Nani pa dancing to mana Aden me pa Aden kra Daya usani da suasa Oye munuma Say one no na one pam To everybody ma wotiti me To asida to me ready Buradi, Nani kumu and kuma in Pawa. Now our bones and is a sewer. Now my be been here. Adana was man is for some day. Aden me back, Aden cry. They was sending a suicide.
All right, we are back from our break. I love music. If you leave me, I'll play music all throughout. But I'm enjoying the dental health program, which is being engineered and fully answered by Dr. Emma Jeffrey. Doc, let me defray some myth here. Ghana, if say so, the CNYs and lose tooth. Is it true that when some women get pregnant, they lose tooth? Or is it possible?
I think some people think that is, it doesn't happen in a vacuum. And see, if the woman is taking care of her teeth, things should go well. But if the hygiene is not good, and so it affects them, because in pregnancy, the hormone levels change, and it begins to affect the gums, etc. Into when the plaque is also, when they don't brush well, it adds to what is present, the plaque, and it causes the inflammation to get worse, which can eventually, progress to severe periodontal disease. And by the time they go through that cycle a few times, the periodontitis, as we call it, the gum disease, progressively gets worse, and eventually they begin to lose teeth. So it's not because of the pregnancy per se, but what they are doing while they're pregnant, because they're more likely to, get gum disease and eventually lose teeth if they do not, take aggressive measures to address that.
That is awesome. So which means some of these myths that we grew up with were all stuff that can be changed, or I mean, we had no idea where they came from and how. Wow, this is awesome. This is awesome. Well, my CEO's wife has joined us. Sister Abna has joined us, and she has a very good question, and I want to read it to you. Please, at what age should a mother stop brushing her child's teeth? I don't know whether that's when she hands over the brush fully to the child to see how when you want to board, and I say, I don't know whether she's still watching over the child. So I'm just reading as it is. At what age should a mother stop brushing her child's teeth? Maybe she wasn't sure whether the child will do it very well, or because some of them they will just put the toothpaste on the brush, lick it, sometimes you swallow it and just spew it somewhere. But I think if the mother is guiding, they know go through all the processes of brushing. And at what age should the mother hand over that job? That now you have graduated, you can brush your teeth by yourself. So I give you that veto power to do it. At what age?
I like your questions because you always answer them before I even get the chance.
Why do I do that? Why do I do that? Please, why do I do that?
Basically, yes. So you've answered in the sense that as we monitor the children, as you supervise, you're monitoring them, you're teaching them.
Doc, pretend I didn't answer my question. I don't know why. But yeah, give me yours.
So we want to supervise until it's like going to driving or taking driver's trying to get your driver's license. So they will not hand you off until you have proven yourself. Until you'll be monitoring the child and ensuring that they are doing it correctly. And every child is different, so we cannot say, oh, it's 6 years for everyone. Some kids might be, they have more manual dexterity, or they are very good with their hands. Cognitive development is different. Some kids are, they are 10 years old when they are 6 years old, really. And see, when your child is ready, you're just basically, observing how they are brushing, how well they are doing things. But then generally, we tend to say you should monitor and supervise until the age of 8. But some children, yes. Mm-hmm.
Oh, okay. Thank you very much.
A lot of parents who we tell that they say, what? Because by 5, most parents are ready to hand off. But
exactly.
It might be a little too soon to, do so.
Oh, okay. I think it goes the same as breastfeeding. Some want to wean their children off so they can maintain their breast size, or some want to breastfeed them for a longer time so their children will be more nourished. It depends on how you want to do it. But I think Sister Abna is very protective of two things: her husband and her children. Don't you go near those people. Sister Abna's husband, Ostus, and her children, don't go near her. So I'm sure she'll be brushing her children's teeth to the age of maybe 12 before she tells them, now you are capable of doing it by yourself. Anyway, thank you very much for that response. Now let's go to something about insurance. Which group is easier to insure? Is it the children or the adults when it comes to dental insurance? Which one is better? Are they the same?
I think, so you're talking about insurance through your employer?
Yes, for children. I mean, which one is more expensive?
Usually insurance covers your family, before you cover your children. So the plans in the workplace, I mean, this is a little, just a little outside my sphere of, it's more administrative. But then Typically, if you're getting it through your employer, they have individual plans and then the family plan. Some employers probably also distinguish between, which part of your family, maybe your spouse only, maybe in addition to children. It varies. I would say that it varies, but generally compared with medicine, medical care, it's less. So if you find that you have dental insurance benefits through your employer, by all means, do take advantage of that. So at least your preventive care is covered.
Yeah, I think I asked that question because of a statement you had made about the braces, that, if you are a child, you are allowed to certain age that your insurance, or you are allowed to have the braces at to certain age. But then if you are 30, 40, 50 years, the insurance might decide not to, or maybe, give you or pay for braces when you are like 40 or 50. Because I know with the children, I think it's easier. But then when you are older, they say, walk across the line, and they might not. I don't know whether I'm right on that.
That's correct. So the insurance companies, they set up their own rules, as in, every other insurance policy we find, whether it's cars or, whatever. So some of their rules are that, children are developing, and so they will fix it while they are young. And then once you are past a certain age, they might not want to cover. But typically, they don't even cover 100%. So they're talking about percentages, etc. So that is true.
Thank you very much, Doc. Thank you. Let me ask this maybe last question or last bit one. Pandemic and dental care. I know when the pandemic hit, it might be very scary for you to go to work and a patient sitting in the chair opening his or her mouth for you to, of course, I know you have all the PPEs, of maybe still put on all your gadgets. Was it safe for you to practice in, especially 2020, when the pandemic was rife at its zenith, and now I know it's kind of going down? Was it scary for you guys, operating or seeing patients in the pandemic when this virus was all over the air and somebody has to come and sit in the chair and open your mouth for you to work on? Is this something that bothered you?
I would say that initially it did, because we didn't know much about, what was going on. And so we were all, but then I'd also add that we're very fortunate. The dentists in America were fortunate in the sense that we had the ADA, the American Dental Association, who quickly jumped into, finding as much information for dentists, and then made several recommendations to keep dentists safe. And that helped a lot. So at the very beginning of the pandemic, they recommended that certain procedures that were high risk should be reduced, and that gave us time to find out more about the virus and to take appropriate actions. I'm fortunate to work for an organization that place a lot of emphasis on, getting information and keeping their employees safe. And I happen to be one of the people who did some research on finding ways of keeping staff safe, the dental staff specifically. And so besides the normal precautions that most offices were taking, we took some extra measures that had not been applied yet. And, we kept many people safe. And to date, I have not, or at least my team has not gotten as far as we know, I should say, has not been infected from work. So that goes to say that, the measures we took have been
paid off.
Yes.
So that's great. Precaution is always good. Let me zero in on this question. I know there are two things that we are not supposed to share. No matter how much I love you, I'm not going to share those two things with you. And one is password. If you go to work, they even advise that you change your password maybe every 6 months or so. So you don't share your password. Or maybe if it's your marriage account, that might be an exception. But otherwise you don't share password. The second thing you don't share is toothbrush. You don't share toothbrush as well. Speak to parents, children who for some reasons have to share toothbrush, which is not recommended.
I don't know if I've ever heard that before, but I will, just in case there are two.
If you Ghana, don't say that. If you Ghana, don't say. We used to do it. I'm not going to lie, but I remember that one time my wife and I think we traveled and were in a hotel. I think she might have forgotten her toothbrush, and I'm sure she stole mine and used it. I'm not telling her, but sometimes stuff happens,
Yes. So as you have indicated, that is not recommended. At the very worst, you can use a face cloth or something and put some toothpaste on it and try to improvise as opposed to using someone's toothbrush.
All right. This is interesting. I don't want to leave, but we have to leave. Last question. All right. This as often a trapia. Trapia. You wouldn't know, do you? Do you know trapia?
I think you mentioned it last time you were here.
What is trapia? You know trapia?
It's a dia.
Okay.
Oh yes.
Back
I
in
saw
the
my
day.
grandmother use that.
Oh, you see. So you haven't used it before, I guess.
I probably have, but I don't remember. Sorry, I remember.
Yes, sorry that you do. Actually, I know Wesley guys, you guys were Dada Bass and Mama Ma, so they give you all toothpaste. You didn't know, we were chewing chew stick. I mean, sometimes you even have to pass through the bush and cut a neem tree and take off the leaves, the green parts, and make it look nice. And you chew. It's bitter, but you chew because you didn't have toothbrush, And Charlie Yabro, we've gone through, the chewing stick. Is it safe for the tooth? Does it hurt the tooth in any way, or it's safe?
I would say, since we recommend that patients use soft bristled brushes, it's possible to brush your teeth too much and lose tooth structure. And so eventually the teeth will get sensitive. They could even potentially get brittle. Some people brush so hard that the layers of the tooth that are outside and supposed to be protecting the inner living part, will become close to getting exposed, which means you can get an infection easily if you happen to get a cavity. And it's possible to brush your teeth too much. And if we are recommending soft bristled brushes, then probably if it's too the bristles are too hard, then I would not recommend. But if you can get it to be, soft enough, maybe there are some people in some remote areas who may not have access to a toothbrush all the time, or a good toothbrush, because you should change your brush, as the bristles get too frayed or, not steady enough. And see if that's all that a person has access to, then I'll probably say at least make sure it's soft, when you're using it.
But chewing stick, we are the ones who chew it to give way to the bristles, because when you chew the stick, it grows into bristles. So that's
it doesn't come okay.
Yeah, some of the sticks are just either they are rectangular in shape or they are cut in such a way they're straight. So you have to chew it for it to release bristles, and then that's what you use. And sometimes we even went to the point of smashing charcoal. They make you grind charcoal, and then you put the bristles in to brush. That's what got our teeth white, or that's what they said. But that was hard life. That was really, really hard life. Anyway, Doc, thank you very much. I don't know whether I can play one music, and then I'll let you give us your closing remarks. I don't know whether the music can play.